We have with us this morning integrative medicine physician. He's the fourth generation owner of the West Clinic, Dr. Jason West. Dr. West, good morning. How are you?
I'm doing great. I hope you guys are safe and healthy. And yeah, what an interesting times we're living in.
No question about it. And you know, you may or may not agree with my assessment that the more we're talking about COVID, the more problematic it probably is for the president. But there are increases in certain places around the country, and some of this data compiled by Johns Hopkins University. Your take on the data, and I guess as a medical expert, what's your opinion of all this?
Well, I think part of the problem, and one of the reasons why the president's getting hammered on this, is because there's so much misinformation that's occurring. And one of it talks about the testing, because if we went out and tested people for Epstein-Barr or human herpes simplex 1, which is the cold sore virus, I think you're going to have a lot of people that are asymptomatic that all of a sudden are going to be like, hey, I have this disease. And even the CDC website says that if you're tested positive for the coronavirus, it means that you have antibodies against COVID-19, but it also means that you could have antibodies against the common cold virus. So I'm not sure that the testing is really as dialed in as it should be. And there's so many people out there that, like 99.9% of us, are really going to survive this just fine. It's the people that have the comorbidities, the blood pressure, the diabetes, they're obese, that are really struggling with it. And so just like everybody else, I'm frustrated with this misinformation.
Let me ask you a question, and you're the expert, I'm not, but I've got a radio show, and I give my opinion every morning. When all of this news started, I began reading as much as I could from people who had varying opinions, and I've concluded that if the virus isn't going away and we're not going to hide forever, at some point in time, the odds are most of us encounter the virus. You say what to that?
I say I totally agree. I think there's literally going to be 100% exposure rate. We're all going to be run across it at some time. And what's really important, and I wish that we would pick up on this, is now is the time to get your immune system healthy. Like, it's literally up to us as a person. And we want everybody else to take care of the problem. We want the CDC to take care of it. We want the government to take care of it. We want the National Institutes of Health. But really when it comes down to it is we have to be healthy to beat the virus, because we're all going to come across it.
Dr. West, last question. We do politics here. You're a medical doctor. What are the politics of COVID? I mean, we've got an old hand that calls the show occasionally and says this thing will be over in November, the first Wednesday in November. I'm not agreeing with that. But how much of this has been politicized?
Well, I think an enormous amount. As a matter of fact, when people say, hey, Dr. West, what do you think about the coronavirus? It's hard for me not to say, I don't know. I'm not a politician. But talking about that at a little bit deeper level is I do think that there is no question there's a political component to it. There's an individual immunity component to it. There's an agenda from Big Pharma that's in play here about trying to get a vaccine developed and quick to the market. And really what I tell people is, look, if you separate all of that out, what it means is you got to get yourself healthy. You got to get to bed on time. You got to eat healthy and alive foods. Get your vitamin A up, which protects your mucous membranes. Help vitamin C, which helps your overall immunity. Water lubricates your mucous membranes. If you do those simple things, it doesn't matter if it's the coronavirus or the rotavirus or the rhinovirus or the cytomegalovirus. That is going to help you, and that's how you're going to beat this thing.
Dr. West, thank you for your time. Have a great day, sir.
All right, you guys. See you later.